Coming up next on Arizona Horizon, the latest in disturbing allegations of deadly wait time delays at the Phoenix VA hospital. A new report on how the drought is cutting water flows down the Salta and Verde rivers, and we'll see how art is enhancing an area of Grand Avenue. Those stories next on Arizona Horizon.
Arizona Horizon is made possible by contributions from the Friends of Eight, members of your Arizona PBS station. Thank you.
Good evening and welcome to Arizona Horizon. I'm Ted Simons. Calls for the resignation of top administrators at the Phoenix Veterans Hospital are increasing. This after reports of up to 40 deaths due to delays in appointments and treatment. Joining us now is Dennis Wagner of the Arizona Republic. You have been on this story from the get-go, and you're still covering this story because this thing is still going on here. What is exactly happening at that VA facility?
Well, I think it's going to depend on who you talk to. If you talk to the VA, they'll say, we've been trying to improve this situation. And if you talk to some of the whistleblowers, some of the vets, they'll say it's a mess and that they'll claim that wait times were covered up. Wait time is the time between when somebody seeks or wants an appointment and when they actually get an appointment. I think they have improved in the past few years, but even a couple of years ago, the wait time was as much over a year for a first-time appointment for a veteran with a primary care physician. They're trying to improve those, but the allegations are that while they're trying to meet the goals to improve those, they allegedly also falsified data and covered up, had a double booking system, so to speak.
I want to get to that double booking system in a second here, but the allegations are that up to 40 veterans died while awaiting care. What do we make of those? Does this mean they died because of the delayed care? They died during the delay? What's going on here?
No, and that's a really important distinction. Nobody is that I know of is saying that 40 people died because they didn't get care. What they're saying is 40 people had appointments that were pending, and they died while those appointments were pending. And they're talking about a longer period of time waiting to get care. But whether they would have died anyway is unknown. Whether some of them may have died for other reasons than that medical problem is unknown, because we haven't seen the list of names yet, and we don't know how you tie that list to what they died of.
And as far as the delays are concerned, I think you reported that they average about 55 days. Obviously, that means some can be a lot longer.
That means so the average is 55 days. They talk about 47% are within 14 days. But then there's a question as to whether those numbers are accurate. That's
Yes.
one of the big contentions right now among whistleblowers, is that those numbers are not accurate.
How do we know how accurate these numbers are?
I don't know. I have back all the way back in early March, I filed public records requests with the VA, and I have repeatedly asked them to provide me documentation on Inspector General reports, on wait time data, on all of these issues. And to date, we have not received a single document from the Veterans Administration.
You have, however, received reports and allegations that there seems to be a secret waiting list in order to hide some of the delays that are out there. Again, explain what's going on here.
There's multiple allegations. It's not just one claim as to how wait times may be manipulated or falsified. One example is that they had been taking appointments on paper documents for years, and they switched over to an electronic waiting list. This is just one example. When they made that switch, allegedly, they started transcribing from the paper documents onto the electronic lists and listing the date that they put it on the electronic document list as the start time when the appointment was made. So maybe somebody had been waiting 4 months for an appointment.
Yes.
All of a sudden you've erased 4 months.
Yes.
Now the VA denies that's happening. Who knows what the truth is there? Another example is calling up and canceling appointments, claiming that the doctor's not available or whatever, and then starting people over and thereby erasing that wait time because the appointment got canceled was another allegation. There's a multitude of different ways that it was claimed to be happening.
And basically, again, you're reporting that some of these falsified records, the allegations are that some of these falsified records may have led to bonuses for reduced wait times.
What the director of the Phoenix VA, Sharon Hellman, says is, yes, I received bonuses. those bonuses were for performance or achieving performance standards, and wait times was among the performance standards. She makes a distinction between it was all for achieving those wait times, but she also flat out says the single most important goal of her administration, she's been there 2 years basically, the single most important goal, and they called it the wildly important goals, the WIG program, was to improve wait times for vets because it's a tremendous concern.
Who is making the allegations? And I know in your stories you have a Dr. Sam Foote, seems to be an early whistleblower. Who is Dr. Sam Foote?
Dr. Sam Foote is a primary care physician, had been with the VA for years. He retired December 31st. Before he retired, he filed complaints with the Inspector General's office delineating how he thought these things were being done and what he thought was wrong with it. And the 40 patients and the other accusations originally came from Dr. Foote. Other VA employees have come forward, some confidentially and some of them on the record, to say they agree with him.
And how were these allegations then made public? It seemed like there was a House a committee hearing?
There was a House Committee on Veterans Affairs hearing, and Dr. Foote had submitted his complaints to the House as well. Many of the whistleblowers are going through various congressional offices, particularly John McCain's office, and he had submitted his complaint to that committee, and the chairman of the committee, Representative Jeff Miller of Florida, during the committee hearing, kind of stunned everybody by remarking about he has evidence of 40 deaths in Phoenix among patients waiting and of possibly falsified data. And I was in a position, at that point, I was in the midst of working on a project on it, but we didn't have any choice. We had to kind of blow our own thunder there and write about it.
Sure. Now, as far as the reaction from the VA, I know you've spoken to some folks there here in Phoenix. What is the official reaction? How are they responding to all this?
The VA, I spent a couple hours with Director Helm and the Chief of Staff over there, Dr. Darren Deering, and a number of other members of what they call the PENTAD, the leadership group over there at the VA hospital in Phoenix. And their argument was, we've been doing our damnedest to improve this system. We have brought in more doctors, more nurses. We are trying to overcome a problem that evolved over years, which was you had a huge swarm of veterans coming into the valley and increasing the workload. At the very same time, they had an exodus in staff. The exodus is attributable to, according to them, to pay issues and some other issues. Other people say the exodus has to do with morale. There's all kinds of theories on that.
As far as now, the congressional delegation, I know there are increasing calls for resignations there at the Phoenix VA. Senators McCain and Flake, congressional delegation, what are you hearing here?
There's an awful lot of, there's a parade of members of Congress who are calling for investigations. A few of them, three representatives have called for either the removal or the resignation of the key administrative leaders at the VA here in Phoenix. And everybody's saying we need to investigate this. There's a House investigation and a Senate investigation planned. Both of those are scheduled to occur at a date unknown after the Inspector General's report comes out.
So basically when the Veterans Inspector General report comes out, that's when we can follow up with some more hearings, I would imagine. Until then, I mean, there are other concerns regarding the Phoenix VA. There's millions of allegations of records missing, overcrowded emergency rooms, hostile conditions, cronyism, the whole 9 yards here. Is this, from what you can understand and from what you're hearing from whistleblowers and non-whistleblowers, just folks who is this systemic? Seems systemic?
Among whistleblowers and among many vets, I mean, I've had easily over 150 vets contact me, emails and phone calls. I've been just beleaguered.
Yes.
And they, as well as the whistleblowers, see systemic problems, serious systemic problems here. Several members of Congress have remarked about just how many complaints their offices are dealing with from veterans who are upset about delayed care, about problematic care. And so I think you could say that there's a groundswell of opinion that there is a systemic problem there. And the question is, with each of the specific items that you mentioned, some of them may have been addressed to some extent in the past couple of years, and some of them may haven't have been. And then there's overriding concern, not only among whistleblowers, but among veterans who are seeking patient care, that if they complain publicly, they may face retaliation.
Interesting. And again, we talked about, I kind of inferred this a little bit earlier, Phoenix VA, not the only VA facility facing these kinds of problems?
No, there are ongoing investigations by congressional committees and inspector generals around the country. If you go to Miami, Atlanta, Memphis, Augusta, Columbia, South Carolina, there's a number of, Pittsburgh, there's quite a few cities that have varying problems. This wait time problem is a significant one in a number of cities. There are suicide problems at a number of VAs. And so you've got a system that seems to be just writhing. And at the very same time, you've got a system that isn't very transparent. There is such a problem of getting records, documentation to find out what is going on in the VA that it makes it all the more problematic.
Last question, what is next in all this and what kind of timetable are we looking at?
Well, I mean, we're doing ongoing stories. There's going to be a series of stories coming out that we're doing, but on the larger picture, the single biggest next event that I can foresee probably would be the Inspector General's report.
Yeah.
But we don't have a timetable on that yet, so I don't know when that's coming out.
So we still don't even know that, do we?
No, they just said that they told to me that they put their quote-unquote A team on it,
Yeah.
and that I know they've got inspectors here right now interviewing loads of people at the VA.
All right. Well, you've done great work on this. Thank you so much for sharing your story with us, and we'll keep following what
Thanks,
happens
Ted.
next.
Appreciate it.
Water flows down the Salt and Verde rivers are well below normal due to a lack of winter rain and snowpack. And here to talk about the latest report on state river flows is Dino De Simone, water supply specialist at the USDA's Natural Resources Conservation Service in Phoenix. Good to have you here. Thanks for joining us.
Hi, Ted. Good to be here.
This is a report on water flow and snowpack. Give me a better indication of what the report's looking at and what the report found.
You bet. Well, the April report is our final report of the winter. And basically, it summarized what we already know. This was a very hot and dry winter. The snowpack was well below our normal expectations. So the effect on the watershed is that we don't have a lot of moisture up there that was going to go down into the rivers, down into the reservoirs.
And it was interesting because it seemed like early in the winter we had a couple of big storms, at least one big storm kind of moved through, and you thought, well, maybe the La Nina thing's full of baloney.
Right.
It wasn't full of baloney. We didn't
No.
hardly anything after that.
No, that was a big boost at the very beginning in November, December, and then it just tapered off from there. Basically, the last 3 months have been extremely dry in the mountains.
Okay, let's talk about snowpack. We'll start there. Levels below normal. How much below normal?
Right. Well, the last time we did an official check at the beginning of this month, we were at single digits. We were less than 10% of normal throughout most of the areas of the mountains of the states. So this is extremely low. The last time we had this kind of a low winter was about 2006. Some residents here will remember. So every few years we definitely have a low snowpack, and this is one of them.
It looked like from the charts that the Mogollon Rim and southeastern Arizona may have been hit the worst
Right.
as far as snowpack is concerned.
Right, and the overall snow and rain in the southeast part of the state have been extremely low. In fact, as of now, the governor's drought task force that I serve on is saying that the whole state is in some level of a severe to moderate drought situation, basically.
Are there areas where the precipitation over the winter may have been enough to, obviously it's not normal or anywhere near normal, but it's not as bad perhaps than it is in other parts of the state?
Well, north of Flagstaff, the San Francisco Peaks area, that received somewhere near about half of normal. But we didn't have any exceptions in the state as far as anything approaching what we would normally expect in an average winter. And of course, in Arizona, we know the average or normal is pretty rare.
Yeah, no kidding. Yeah. Now let's go to stream flow. I know that was another rubric here. Sounds like it's well below normal for spring.
Yes. In fact, as of today, our salt and verde systems are flowing at less than 1/4 of normal. The salt system is down below 10% right now. So we are not contributing much runoff into those reservoirs right now.
And it sounds as though perhaps the Verde is in better shape than maybe the Gila and the Salt and the Little Colorado. Do we know why?
Well, the Verde watershed did receive a little more than the other watersheds as far as snow and rain. So as of this month, we're saying it's about half of normal.
Yeah.
But again, that's still not very good. The Gila system was down to 0% of normal during this month. So there's really no snowpack left. We had this little storm this past weekend that dumped a little bit here and there, but very little.
Just for those of us who aren't quite familiar with where some of these mountains are and how they get to the Gila and the Salt and the Verde, when you say that the Gila is in such bad shape, where are the mountains that aren't helping things out?
Right, so southeast Arizona going into New Mexico, those mountains contribute to the main Gila River, which eventually flows down to Yuma and down into Mexico. But that system itself covers a big chunk of southeastern Arizona and into New Mexico, and it received very little snowpack this year.
Isn't that something? Stream flow, obviously bad, as you mentioned, you gave us an idea. Is it how much worse than in previous years?
Well, this is one of, again, the 10 worst records, 10 worst winters on record that we have as far as the overall snowpack and rainfall. And that translates into the stream flow. So again, that's in, I guess you could say, the 10 worst record as well.
And you mentioned stream flow into reservoir storage. How much below normal are those reservoirs?
Well, right now, fortunately, I've talked with my partners at Salt River Project today, and we're a little above half of storage capacity right now in the Salt and Verde reservoirs. So they tell me we're okay. We get worried when we have 3 or 4 very dry winters in a row. We're approaching that. We did have an excellent winter a few years ago, some of us may recall. If we go 2 or 3 more winters like this, it's not going to look good. But for right now, the reservoirs are okay.
As far as, and especially the Salt and Verde reservoir system, you said a little bit over half capacity. Right. Compared to last year, compare that to maybe the 30-year average.
Right. So the 30-year average, we are at, again, about a little over 50%, half of capacity. You can see that when you're out at the lakes. I was out there not too long ago at Roosevelt Lake, and you can see the bathtub ring. It's just not anywhere near it was when it filled to capacity in 2010 when we had that excellent winter.
Is it unusual to have it at capacity and then what, 3-4 years later, half or even less? I mean, that seems kind of unusual.
Well, that's just our first dependable supply is that surface water that we like to use before we start pumping it out of the ground, which is much more expensive to do.
I noticed that the San Carlos Reservoir was 11% of capacity. The San Carlos Reservoir, where does that water coming from?
Well, that is on the Gila system, and that serves a large farming area there in central southeast Arizona. So that is a very particular hotspot because they depend almost entirely on that surface flow for much of that farmland.
It's interesting. Southeastern Arizona really didn't get much at all, did it?
No, it's hurting this year.
How are these measurements taken? I mean, how do you go about doing this?
Well, actually, that's a neat story. I'll do it very briefly, but we do have automated sites now that we've had for many years that measure that snowpack, how heavy it is and how much water it contains. But we also still have a lot of manual sites. So we go out every winter several times and we take these snow tubes and we measure the depth and the weight of the snow and convert that into how much water is up in the mountains.
And from that you make the forecasts?
Right, so step 2 is we take that information and along with the soil conditions as well as the temperature conditions and the predictions for the next few weeks and months. That's where we come up with the stream flow forecasts.
So we've got the report, last report of the winter here. We've got the forecast, and we certainly see what's happened here in the past. What is all of this telling us?
Well, again, basically, we are definitely in what our state committee is calling a drought at this time in the state. And you have to keep in mind, when we say drought, we're talking about both the land as well as the water supply that we've been talking about. So the land is probably more critical right now. We have areas of the state that are so dry right now. The soil is without moisture, and any plants that have been growing have started dying already. So that is the main concern right now, is what I call the ecological drought that is going on. The hydrological drought, as we discussed, is more the water supply getting in the reservoirs. They're okay for now, but the land itself, and this is why you're hearing stories about the fire danger coming up.
Yes, and bark beetles and these sorts of things, because you could have a boffo winter here and get those reservoirs back up to some sort of normal level, but that land still needs a lot more than just one big system.
That's true, and we need that rainfall and snow spread out over time, keep the plants going. So what I'm telling folks is now is the time to be water-wise and fire-wise, because water-wise, we need to always conserve water living here in the desert. Fire-wise, because those plants, if they're drying out on you, you need to get them cleared away from your properties and save your properties.
Well, very good information. Good to have you here. Thanks for joining us.
Thanks, Ted. Good to be here.
If you've driven along Grand Avenue in Phoenix lately, you may have seen artists decorating street-side planters. The Adopt a Planter project is working to attract visitors to art galleries on 12th Avenue and Grand. Producer Darcy Machado and videographer Juan Magana took a look at one planter artist's vision and inspiration.
I just love mosaics. I really do. I love painting with glass. This is a planter project that the city did for this Grand Avenue, and they installed 55 planters along the bike lane and then invited artists to come and do each planter in their own style. This is an Arizona themed planter, so you'll find different Arizona images in here. You're going to see a phoenix, a thunderbird, you'll see the state bird, the state flower, the state snake. So as you look throughout, you're going to find little images that represent Arizona. This one is very unusual because it's done almost entirely in stained glass, and most mosaic is done in, say, broken pottery, broken dishes, ceramic tiles, if it's on this scale. So I've actually taken stained glass and used it as more of a fine art mosaic for this. Each sheet, about 1 foot by 1 foot square, is $10 to $25. So there's literally a few $100s worth of glass in here. There's a lot to learn in the sense of movement in mosaic, because you're taking something that's cold and stiff and hard and trying to give it some kind of fluidity. And so you learn, it's called adamento, and that's the movements you're seeing. So there's a reason why that will look this way, this comes around. It's to be visually pleasing to your eye, so you cut on purpose. You take an image, which I have drawn on in chalk in my instance, and then I cut the glass to fit. And because of the curved surfaces, we do a lot of scoring, which we normally wouldn't do on a flat surface. So it presents a whole different set of problems, just the way it's shaped, as opposed to doing the side of a building. I like that they're going to see it. It's almost like an outdoor gallery. If you don't have the time to go indoors, and a lot of times people don't, you can come through here and see all the art on display. I just love it when people get inspired by the mosaics especially. I really like bringing that to people, and I've had people come by here every day or so just to watch the progress, and it just feels really great. A lot of the community feels like it's their planter, and that really feels good to me.
And many of the planters decorated along 12th Avenue and Grand have been finished and can be seen from the street. Tomorrow on Arizona Horizon, meet award-winning scholars looking to use their honors to continue careers in science and engineering, and find out about a company that has a new product for artificial pollination. That's tomorrow, 5:30 and 10 on the next Arizona Horizon. That is it for now. I'm Ted Simons. Thank you so much for joining us. You have a great evening.
Arizona Horizon is made possible by contributions from the Friends of 8, members of your Arizona PBS station. Thank you.